your name and what do you do?
Hi, my name's Tom Ford. I'm a trainee clinical scientist.
What does your job entail?
So what I do in the lab is I look at samples that clinicians send to the laboratory, and we do tests on them, and we interpret the results from those tests and see if we can help the clinician actually see what's wrong with the patient in question. And as well as that, we do research to try and look at new ways and better ways that we can actually diagnose these problems and help these patients. Hopefully the research that we do in the clinical laboratories is going to take us down the road where the diagnosis of diseases is actually going to be quicker, cheaper, easier and more accurate, which is the important part, so that a patient from coming into hospital can actually can get to the end point where he or she has a diagnosis and a treatment program. That space of time can be quicker. So I think that's the important part for clinical research, is to kind of shorten this time and to make it more accurate as well.
Do you have to study a lot?
I went to university, and before that obviously went to six-foot school, six-one college, and I did a science degree, so a lot of it is kind of learning through universities, from textbooks, from lectures, etc. But then an awful lot of the learning that I've done recently has been from the laboratory. So actually, looking at individual patients that come in, looking at the technologies that we use, as well as talking to clinicians and talking to other scientists, which is probably the most important part of it. So it's actually sort of more exciting learning than actually just reading books.
What do you like doing in your spare time?
I do lots of things to unwind. So I'll go out and socialise with friends, go to the pub, go to the cinema. I did my degrees in Scotland, so I spent a lot of time climbing up there and walking up in the hills. I also played rugby and played five-a-side football as well with friends. So lots of things outside work. It's very important to do those kind of things as well.
What do you like most about your job?
I think what I like most about my job is that it's so varied. So, because every patient's different, every sample, every tube of blood or serum that we get in through the door is completely different. The history of the patient's different. The spectrum of diagnostic assay results is different. So every sample has to have its own interpretation. So from day to day, you don't know what you're going to get. You could spend a day of getting kind of similar things and things that you might expect, but then the next day it could be a completely unexpected thing that would cause a problem, but it's those problems that are actually quite exciting because they make the job worth doing.